Time's expired.
Kia ora.
Jackie Blue.
Thank you, Mr Speaker. I'm delighted to participate in this debate on Budget 2011. It is a budget for our time, and like the previous speaker, my colleague Chris Tremaine, I'd like to take the time to wish the Honourable John Carter all the best and the cooks, and I know that the Honourable Craig Foster will do an excellent job as a Minister. It's well deserved. This is a budget that's not about borrow and hope, Mr Speaker. It's a budget that's been very carefully thought out. It's a budget for our time. It's a difficult time we've had in the last couple of years. So it has been taken very seriously. It's about getting those next steps and building faster growth, increasing national savings and creating sustainable jobs for the future. It's about ensuring the government does return to surplus by 2014-15. It's about halving the deficit next year and halving it yet again the following year. It's about investing significantly in health and education while continuing to protect the most vulnerable New Zealanders. Mr Speaker, we have clearly set out our policy to New Zealanders so they can give us the verdict come election day, November 26th. The voters can decide. There is no lolly scramble. We can't be irresponsible. We can't engage in a big spend up and a big knees up and put our economy at risk, Mr Speaker, when New Zealanders are working so hard to pay off their own debt. Equally, the budget is not slash and burn. It's been very carefully thought through. It's about building faster economic growth around higher national savings. It's getting a credible path back to surplus, Mr Speaker, and it's about rebuilding Christchurch over the next few years. My congratulations goes to the Honourable Tony Ryle, who over his term as Minister of Health has shown remarkable leadership. Vote Health was the biggest recipient of Budget 2011. Health was one of the few areas to receive modest funding increase, which will be paid for through making efficiencies in other government departments. It continues the government's election pledge to continue the growth of funding in the public health system. Budget 2011 is delivering an extra $2.2 billion over the next 4 years, including an additional $585 million in initiatives this coming year. The budget included $80 million for widened access to medicines, and it's expected that around 32,000 patients will benefit from that widened access in the first year. In all, together with $100 million that have been put in for medicines extra in the last 2 years, over this term, the government has invested an additional $180 million of extra money in medicines. That medicines means more patients will get access to the drugs they need that will keep them healthy and well out of hospital, and that's what it's all about. Mr Speaker, despite the serious economic situation we have been in, the government has continued to invest new resources in the health to meet our commitment for strong and enduring public health service. This is in contrast to many countries around the world who have taken the opposite approach. They've slashed their funding to public health services in response to the global financial crisis. While New Zealand has weathered the storm better than some countries, Mr Speaker, the government has still to make some tough decisions, especially in the face of the events of the two Christchurch earthquakes. Indeed, the world did change. New Zealand changed on February 22 this year and had both an amazing and considerable impact, both in personal and financial terms, and on the whole of the Canterbury region. While we've had to provide support packages to the people of Christchurch in the short term and to the displaced population, whether they remained in Canterbury or been elsewhere in New Zealand, it has put tremendous pressure on the health services across the country. Facilities in Christchurch, both public and private, have been damaged, some beyond repair, and the efforts of the entire health workforce in Canterbury and the extra assistance provided nationally has been absolutely outstanding. I'd like to take the time to acknowledge and commend those workers for their work and their perseverance. I want to focus on one area, Mr Speaker, that will make a real difference and that in health, and that is the extra money that is going into mothers and new babies. There is over $20 million over 4 years for well child visits. Currently there are 12 free child visits from birth to 5 years. The additional money means that there will be an extra 54,000 well-child visits, which averages out to an extra 3 visits from birth to 8 weeks, to be targeted to those mums and babies who will benefit. There is also over $33 million over 4 years for quality and safety initiatives. These include multidisciplinary reviews of all births, parent information services, assisting vulnerable mothers' access to health and social services, assisting midwives to make appropriate and timely referrals to other practitioners, and a one-off funding of $2 million for the collection of national DHB maternity data. I know that's been very well received. These budget allocations build on the extra $103 million that was in Budget 2009 for maternity services, and these include longer stays for new mothers in hospital, optional team meetings each trimester for the at-risk mums, full funding of Plunket Line, and obstetric training and or refresher professions for GPs who want to get back into deliveries, and also meeting the costs of the extra births each year. It's very clear that better economic performance, Mr Speaker, will enable us to spend more on healthcare, and at the same time New Zealand must strive to get more services from existing health spending by reducing waste and bureaucracy and lifting productivity. There's no doubt Budget 2011 sets out the next steps to build faster growth, increase national savings and create sustainable jobs. Strong fiscal policy and management from this government and commitment has provided the backdrop against the interest rates, which have fallen dramatically to the lowest level since 1964. Tax changes have put more money into the back pockets of hard-working Kiwis and more money into household budgets at a time when it's really needed. Annual inflation when Labour left office was 5.1%, now it's 4.5%. And that includes the one-off impact of the GST rise in October, for which everybody, including beneficiaries and superannuitants, benefited and were compensated. Our tax reforms mean that 3/4 of New Zealand taxpayers now face a top marginal tax rate of only 17.5%. Despite difficult global conditions and international pressure on food and petrol prices, our tax reforms have helped to ensure that Kiwis' after-tax wages, on average, have risen faster than the cost of living. Increases in after-tax wages have flowed through to superannuation rates for older people, with superannuation rising $166 a fortnight for a married couple since September 2008, an almost 20% increase, or 8.5% once we adjust for inflation. And just today, we've had very good news that the total number of people on welfare has dropped by 2,295 in the last month. The total number of benefits has fallen for 4 consecutive months. That is extremely good news, Mr Speaker. There is no doubt that the government's Future Focus package and increasing business confidence have made a real difference, and more people are finding work. More than 9,000 New Zealanders went off benefits and into work in May, and that's down to greater business confidence. And more businesses who have confidence will employ people, they will expand their businesses, and that is what we're seeing. It is clear that reforms that have already been implemented by National are having an impact. Our economic performance will deliver higher incomes, Mr Speaker, but will help people directly and will allow social spending to grow where it is needed. Thank you.
Chris Farfoy.